Hello, everybody.
Good evening. We ready? Okay, let's get started. Thank you all for joining me on this December 2nd Town Hall meeting. I am Councilmember Pam Foley, if you don't know, but you're here, so that means you probably got our newsletter, and that means you either live in District 9 or you're a friend of District 9. Welcome here. We are here for an hour. We are going to be listening to a presentation by Kip Harkness, who will be talking, I will be introducing to you in just a couple of minutes. But I wanted to give you an update, give you some ground rules, tell you about a little bit how this is going to proceed. This is a little bit different than our office hours. I know some of you, I recognize your faces and your names, and you come to my office hours, and thank you very much. The office hours is really interactive, really casual. That's a Friday. Our next one is December 11th. That will be the last one of the season. And that is an opportunity for you to just ask questions. There's no presentation. We just sit around and have a virtual conversation and a virtual cup of coffee. The town hall is a little bit more formal in that we have a presentation and then we will be asking questions. If you have questions, there will be an opportunity for you to ask them, but we're going to have you do that by entering your question on the chat wall. I'm going to introduce I have two staff members here right now. Scott Hughes, my Chief of Staff, and Michael Lomeo, my Senior Policy Aide, and he is here to give us some directions and ground rules on how to enter your questions. Michael?
Thank you, Councilmember. Yeah, so thank you for joining us, everybody. You might have noticed, but everybody upon entry has been muted into the conversation. This is on purpose just to make sure that the conversation remains orderly. If you do have a question, feel free to enter it into the chat feature on Zoom. And for those joining us on Facebook Live right now, you can type that onto the Facebook comment section, and I'll be sure to be switching back and forth between the two software platforms. Well, again, thank you so much, and I look forward to the conversation here today.
Great, thank you, Michael. So here we are, December. We've been in COVID, dealing with the pandemic since, well, probably since February or before that, but we were in shelter in place in mid-March and we've been there ever since. And you all know that we've been moving further into actually sliding back and heading further into shelter in place and more restrictive conditions. And that is because the number of deaths have escalated and the number of positivity tests are increasing. Our guest today is Kip Harkness, and he will be going into tremendous detail. Well, detail, I don't know about tremendous, but he will be going into detail about COVID, the city's response, and other details around COVID, but also talking about emergency preparedness and things that the city will do to inform us and to help us and how we can help to prepare ourselves. I do want to mention that this Friday, I know one of the things that as we've been in COVID, it's really been an interesting observation in our character and our ability to withstand the conditions we're living in. And some are living in very difficult conditions. They're living in crowded conditions that may be overexposed to COVID more so than many on this call might be. But we all are living in shelter in place, and that creates its own dynamic, its own personal issues. I know for me, I live in my house. I have an office where I don't venture very far from. I'm on a Zoom call almost all day, and I find that I'm struggling, the longer this is, I'm struggling to hang on mentally in a positive nature. So every day I try to focus on the things that I have, the benefits I have, and go with grace. I try to be grateful and to realize the things that I have. And the one that I have is that I do have my health. I have a daughter who is healthy and working, and I have a job, and I have staff that is exemplary at taking care of our residents in District 9. So I'm grateful for my staff. I'm grateful for the team around them and all that we're able to do for you. And I'm grateful for you, our residents. I know this is hard, and I know you would love us to say we're out of it, but we're not, and we're going to be in this for a long time. So together we can actually get through this. I know it's hard. It's as I've shared with you many times before, mentally it is a struggle, but others are struggling financially, they're struggling physically, emotionally. We just need to be around to support them. And I worry about all of those who are at risk, older populations, people who have underlying illnesses, who our teachers, our educators, our children who are maybe suffering from the education that they're receiving because it is so different and it's not the world, the way that they're used to learning. But I don't want to take this in a real negative tone. It's just, it is where we are. So let's try to focus on what is good around us, and be kind to those around us, as hard as it is, and be patient. It is really hard to be patient right now. People are grumpy. I'm pretty grumpy. So let's try to go with grace as much as we possibly can. In that line, I know that I have heard a lot of people complain about trash and how the city is not looking very good, but actually we've turned a corner on that. We have, in the early days of COVID, we pulled all of our people who were involved in cleaning up the streets, removing broken down vehicles and such, abandoned vehicles. We've removed them to the emergency operations center and dealing with the pandemic. But now many of them are returning back to take care of our city, which is really important. So you can see now, if you drive around, certain areas that you have complained about as having blight have been cleaned up. Some of our creek beds have been cleaned up. Our underpasses are being cleaned up. Everyone is coming together. Valley Water, the county, the city are all coming together and doing what we can to clean up our environment and make it a little bit easier to drive around. But there's also, so we have, as a city, we have increased our funding to beautify San Jose, which is responsible for cleaning up the city. We have the reason I'm mentioning this is that on Friday at 9 o'clock, from 9 to 12, we have a study session from Beautify San Jose. So if you're interested in that, we can put in the chat box the link to access that information. It will be something that you can observe. There'll be a presentation, and I believe there is an opportunity for public comment in the study session, although I'm not totally sure about that. But it will be good information about what the city is doing to clean up the city, to clean up around encampments and that sort of thing. So come into that. That is the reason that I am not having office hours. I would have normally had my office hours this week, but it conflicts with the study session, and I think we should all be there instead. I need to be there. The next office hours is next week on Friday, December 11th from 9 to 11, and bring your questions and we'll just have a chat about what's on your mind. And hopefully we will have answers for you there. If not, we'll do some research and get back to you. But I really love these. I've had 2 of them already, and I find it so helpful to me to first interact with you because I don't get to meet you in person right now, and that is really hard for me. I love to interact with you individually as a group, but in person. This is the next best thing for me, and the office hours really, really helps us to connect to you and you to us and to find out what's going on in your world that we can help you with. So please come to those office hours and spread the word. With that, I think I'm going to, I've kind of blabbered on a little bit longer than I thought I was going to, but that's okay. One other thing, really, really important. it's the holidays, right? And we know that small businesses are struggling. I am making a concerted effort to support as many small businesses I can during the holidays and always. So please support your local businesses, be they D9, wherever they are. Support your local small businesses. I know my instinct is sometimes to go on Amazon and buy something from Amazon because it's easy, but we need to keep our longtime businesses around and successful. And to that end, we have since the beginning of COVID done a small business shout out on Saturdays, but we need your help. We're kind of running out of ideas on businesses that we should give a shout out to. So any business, doesn't need to be a restaurant, could be your hairstylist, could be a small boutique, a bakery, a small boutique of any type. Please let us know who they are. And they do have to, the only condition, they must be in District 9. And then we will do a shout out for them and try to drive some business over to them. That's the one thing we can do. We don't have a blank check that we can write to small businesses to help them out, but we can try to help drive businesses to them to help them out. So if you have any suggestions, put it in the chat box and we'll make note of it, and we will try to put them on our Saturday shout out for small business. With that, I'd like to take a moment to introduce our guest speaker, Kip Harkness. KIP's purpose is to awaken talented people to the spark of their full potential and enable them to change themselves and the world. I've spoken with Kip several times on many different levels, and he is so inspiring. We've talked about strategic planning, a lot of other things, but he's not here to talk about that, unfortunately. He could give a whole seminar on strategic planning for weeks, I think. But what I found interesting in your bio, Kip, is that your career journey took you from Timbuktu to Silicon Valley. That's quite a travel area. Along the way, Kip has advised farmers on the edge of the Sahara, created the national award-winning Strong Neighborhoods Initiative, managed complex real estate deals, and led a network of team technology leaders. He is currently Deputy City Manager for the City of San Jose, guiding leaders to the execution of the city's enterprise priorities of building the San Jose of tomorrow, that deals with speeding up the entitlement and permitting process, creating a smart and sustainable city, driving the adoption of 21st century infrastructure with technology and innovation, and then emergency preparedness, which is why he is here. His portfolio has included responsibility for operations with over 1,700 employees, $480 million annual budget, and $2.5 billion in capital projects. Since January 24th, he has led the city's response to the COVID-19 pandemic as the director of the Emergency Operations Center, commonly referred to as the EOC. With that, I'm going to turn this over to Kip and be fascinated by your presentation. I'm sure I will learn something. Thank you. If you have any questions, we will get to those at the end of the presentation.
Thank you, Councilmember Foley. I'm going to attempt to screen share here. So if I've messed it up, wait a minute. Let's see here. Let me do this. Okay. So which screen are you seeing? Because I can't tell on this one. Are you seeing the notes one or the full screen?
The notes one.
Let me swap it out then. There we go. Now you should see a piece of art. Yep. With a young girl. Yeah. So this is kind of a moment in our time, right? This is one of the art pieces that we commissioned. We commissioned over 100 pieces of art all by local artists related to the COVID pandemic. So I just sort of have bookending my presentation with that. Thank you, Councilmember Foley, for super kind introduction. It's been a long time since I've been to Timbuktu, but that is actually the first place that I worked while I was actually still in college with Peace Corps. And I'm gonna be, as I always am, pretty open, candid, and direct tonight about what we're doing and what I think we're doing well, what I think we need to learn on, because emergency management is a team sport, and like any team sport, it's one where you're always learning. I also want to let members of the district know that you have a very fierce advocate in your council member, making sure that not only the district is taken care of, but especially seniors across the city, something that she's always championing and making sure that we're paying attention to, as well as making sure that you have the best information on things like the emergency management and COVID response. So I want to talk a little bit about emergency preparedness, emergency management in general, and then I'll go into the specifics of COVID, highlighting some of the aspects of our response, some of the strengths and weaknesses, and then we'll allow some time at the end for questions and answer as well. So everything has an origin story, and for the city of San Jose, in many ways, our origin story on where we are in emergency management was the 2017 President's Day flood. Now, as you're looking at this picture, it's quite obvious that when you have 13 feet of water going over the top of a dam, you've got an issue. I, at that point, was a deputy city manager, but I didn't have the emergency management portfolio. I remember flying in, I'd been on vacation, and I was flying back to San Jose, and I was like, wow, it looks really wet down there. And when the plane landed, I texted the city manager. I'm like, do you need me to come in and help out on any of the stuff related to the rains? He's like, yes. Start at 7 p.m. tomorrow night, go get some rest. And so when I came into the Emergency Operations Center, 7 p.m., February 21st, 2017, 3 of the neighborhoods were already flooded, and we were already behind in our response. I immediately issued the orders of evacuation and belatedly began noticing people. As you can see, we weren't as quick as we would have liked to have been, and we ended up having to pull out hundreds of individuals by boat. Unfortunately, many of them were elderly Vietnamese who had literally been boat people themselves and had very traumatic experiences of being in boats. So this was a double trauma for them. And then we spent the next several months, and this is a picture of the Emergency Operations Center, the EOC, responding, cleaning up, and learning the lessons of how to approach a crisis. And I didn't realize it at the time, but that was a gift. It was a gift to us because it was a wake-up call. It showed us where we had a lot to learn, and it gave us, it turns out, some time to learn. And so one of the key things that we learned is that you really want to start with first principles. You want to understand why you're doing what you're doing. And we came up with these 3 principles which guided us in the flood, and we've adopted now for COVID. First is be compassion in action, right? It has to go beyond words. It has to be action, and has to be action that is focused on those who are most vulnerable, right? As a unit, you need to be open, candid, and direct. As bureaucrats, we have a, unfortunately, sometimes well-deserved reputation for kind of coming at things sideways and maybe taking a little bit of time and sending the memo to the subcommittee, and then it goes from the subcommittee to the main committee, and it'll come back on a referral as a cross-reference to the later blah, 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 and then 2 years later, nothing has happened. In an emergency, you don't have time for that. You have to call it like it is. I was pretty lucky in my family growing up. My dad is an immigrant from Germany, and Germans are wonderful people, but they're pretty open, candid, and direct. He was also a United States Marine colonel. So growing up around our dinner table, we learned how to have open, candid, and direct conversations. And so I feel like that was a gift he gave to me that I tried to bring into our Emergency Operations Center. And then the last one team. You know, we again, as good bureaucrats, it's very easy. Well, this is the Department of Transportation, or this is the Parks and Recreation Department, or I'm this unit or that unit. Nobody cares. And in an emergency, nobody has the time to worry about those distinctions. You have to act as one team within the city, with our partners in nonprofits, with the county, with the state, and with the feds as much as possible. So we've carried those principles forward, or we've tried to in COVID. But as I've said, this is always a learning process. Action, reflection, feedback, correction, right? The other thing that we were able to do is we were able to prioritize emergency management. It had been a unit under the fire department, and we had some good people in there, but as a unit under the fire department, it sort of got second shift to the very real day-to-day emergencies that fire had to do. So we moved it into the city manager's office, which is the only place in our organization where when you go across departments, you can make a decision that applies to all the departments. And we prioritized training over the next 3 years of the entire city that was going to be having to respond to the next emergency. And the next emergency is a long list. Emergency managers are professionally paranoid. After having not had much experience with it, I spent the last 3 years undergoing a lot of training on this, seminars, webinars, in-person trainings, multi-week trainings to try to understand this. And you begin to assess your threats and prioritize them. We have a number in this area. The one that I always keep top of mind is pick your favorite fault line, right? Calaveras, Hayward, San Andreas. One of those is going to pop, and it's going to pop at over 6.8, 6.9, 7, 7.2. And then we're going to have to deal with what happens when the earth shakes. So we focus a lot on earthquake preparedness because if you can prepare for an earthquake, you're prepared for about 80 to 90% of the other things that might happen. But any of these things might happen. And in fact, many of them have, everything from wildfires to not so much hurricanes here, but floods, extreme heat, earthquakes, drought, and pandemic, which we wouldn't necessarily have put at the top of the list, but here we are now. So what is emergency management from the city side? What is the EOC? The EOC is actually modeled after the Prussian military structure that then was adopted by almost all of the militaries in the world. And it's what's called a general staff model, where you have a clear, unified command and the ability of the general to have the support that he or she needs to be able to make the decision. In the emergency operations, we've taken that, and rather than having a general, we have what we call the management section, which is in black. There are some branches that are within the management section, which include public information, liaison with the council or other nonprofits, legal advice, safety. And then there are large sections: operations, planning, logistics, finance, admin, and recovery are the standard ones that we have. What's great about the system, which is called the incident command system, is that anybody who's trained in emergency management, anybody who's trained in fire, anybody who's trained in police knows this system, so that they can come in and they can function as part of the team, even if they're from a different city, county, or state. And it's like an accordion. It can be expanded, contracted, or modified to meet the needs or the issues raised by that incident in a way that everybody understands. So I'll double click, for example, on operations section. The operations section is the one that is most responsible for the coordinating with the field. And so the operations section in the EOC is subdivided into something like this in our era of COVID. And it even gets more complicated. So let's pick one of these boxes, our food and necessities branch. If I were to double click on that, the organizational structure for that would again look something like this, with at peak over 750 people directly involved in our emergency management response, guiding the full 7,500 person organization. But again, as much as this is a little bit of chaos if you're seeing it for the first time, if you are trained in the incident command system and the EOC structure, you know automatically who you're reporting to, what your goals are, and how you can go about getting resources to achieve them. And really what's powerful for us is normally in the city, the only person who can resolve the issues is right at the top, the city manager. The EOC structure pushes down authority as far as possible and gives staff a great deal of autonomy to make decisions rapidly and to move resources quickly without our normal bureaucratic red tape or procedures. So we, as I mentioned, we spent the last 3 years training and trying to train as a team. One of our last big in-person trainings happened to be on the 30th of January and included Councilmember Foley, where we walked through a simulation of the first few minutes of an earthquake scenario and actually did an exercise that involved the actual participants in the Emergency Operations Center in sort of a theater in the round. And that gave everybody, including the council members, the chance to see how we work and strengthen our capability of communicating and working together. I'm really glad that we did that, and our timing happened to be pretty near perfect or pretty near lucky on that. I think there are a couple of other things I want to share that I feel like I've been really lucky on. One is to have this phenomenal team. Everything that I'm talking about today is the work of a team, is the work of people who are not me. I just get to tell their story. I also feel like I've been very lucky to have a series of life experiences that have prepared me to prepare the team of leaders for a moment like this. Councilmember mentioned the Timbuktu to Silicon Valley. It's literally true. I worked in Timbuktu. I've also spent the first decade of my career actually in Northwest and Central Africa. This picture on the right, my staff told me to make sure it's clear that that is a picture of me, because obviously to me it's a picture of me, but I think a few things have changed apparently. And they wanted to make sure that I noted that that was me, because they thought it was pretty funny when they saw this picture. But that's me when I had hair. And I'm a very arrogant and ambitious 23-year-old in this picture outside of my mud hut. And part of my job at that point is I had just lived through a cholera epidemic in N'Djamena, the capital of Chad, where thousands upon thousands of men, women, and children had died in the space of weeks to cholera. And I was a water and sanitation and public health volunteer who was thinking about how do you prevent diseases and how do you prevent epidemics from being passed along. I came back and I worked in Washington, D.C. at Peace Corps headquarters, and a group of us from the health unit went out and had listened to a talk by Lori Garrett for her new book, The Coming Plague, Newly Emerging Diseases in a World Out of Balance, which talks about what would happen if there was an overspill from an animal species onto humans and a zoonotic plague that resulted from that, much like the 1918 influenza. And this was in the early 90s, and we spent the next 3 months pretty much in utter fear of what would happen, thinking about that, talking about that. I happened to work with the United Nations at that time and was representing Peace Corps in a guinea worm eradication, disease eradication effort globally. Worked with some of the premier experts in infectious disease at USAID. And so while that was a long time ago, it planted in me a seed of what might happen if there's an epidemic, and prepared me to be thinking about this in a way that I think has actually turned out to be pretty useful for us as a city. So one of the first things I did on January 24th, when I realized, following the fact that Chinese Politburo had met, that this was likely to be something serious, is we put together our pandemic plan. We dusted off a plan we had from 2009 about potential flu, and we built a series of rational stages where we would advance through in order to increase our responsiveness. Now, at this point, I admit most people thought I was Chicken Little, and part of what you do with this is you create a series of stages so that you don't overreact. But emergency management, I've learned, is a series of mistakes. The question is, what is the direction of your mistakes going to be? Are you going to lean toward being overprepared and overly cautious? Or are you going to lean toward being underprepared and underly cautious? And I found that it always pays off, even if it annoys people, to be a little bit overprepared and a little bit overly cautious. So we moved forward with that fairly aggressively, even before there were confirmed cases in the United States, and even before there were fatalities. You can see from this graph how, starting on January 4th, we did our planning. We moved into our second stage on the 31st of January, and then gradually moved through our stages, and then more rapidly as we got to what we all now know of as the real start of this thing, the shelter in place, around the 15th of March. And you can see this is the cases nationally at the time. So the good news is we and with the help of leadership of folks like Dr. Sarah Cody, we're actually able to get ahead of this thing. We were one of the first places in North America that had this virus circulating in the community. We were the first death in North America, and we, by all means, should have been the epicenter of the very worst of this. We've avoided much of the worst of it because of the leadership of folks like Dr. Cody and our ability to move very rapidly towards shelter in place as a city and a community.
Kip, can I interrupt you just for a minute there? What you're saying to us is just taking me back so far, and I remember the EOC training that we had January 30th, and even saying, well, you know, earthquakes are the big deal, and that's what we need to be worried about. And I think you probably brought up, well, yeah, there is this pandemic thing that might be a big deal, and shoot, there we were, and ever since then, we were getting weekly updates at our council meetings from you and the team about how we're responding to the pandemic, even before we were sheltering in place. So you were taking us through the stages, and I'm not sure we all believed where we would be today, but it's just really taking me back to January and February and March. And wishing we weren't there, but I'm sure glad you're there and have prepared us in the way that we have. So thank you.
You're welcome. I feel like, you know, those 2 extra months that we got to think about this were really crucial. We were able to look at Europe and learn what was going on in Europe. We were able to think about how to prepare our essential services. We were able to begin to check in on supplies of things like masks and PPE. And if we hadn't done that, you know, we wouldn't have been able to pivot as quickly as we did to the shelter in place. So I feel like, yeah, we had a good small team. First, there was only about 12 of us working on this. And then, like I said, you know, up to 750, and in fact, the whole 7,500 person organization. But those extra couple of months of planning really did pay off for us. You know, we realized early on that we were facing these 3 challenges of now. We needed to address the public health crisis and save lives. That was the key imperative. But we also have an economic crisis precipitated by the necessity of sheltering in place, and that imperative is save livelihoods, right? To make sure that the businesses and individuals can have an economic way of going forward. And then the third one related to the economic crisis is dealing with the fiscal issues on the city side, and making sure we can keep the money flowing so that we respond to 1 and 2. I think of this as sort of like higher math, right? If you only had to solve one of those equations, pretty easy solving for one variable. But solving for all 3 was really hard because they're competing against each other in some ways, and you have to make sure that you can't maximize, you have to optimize. And so a lot of what we're doing as we look at our response is, how do we save lives? How do we save livelihoods? And how do we preserve the fiscal health of the city so that we can do 1 and 2? Part of what we knew we needed to do is we need to very quickly understand what was most important, what would we say yes to, and what we say no to. We developed what we call our COVID response roadmap. I won't go into all of the details here, but I just want to walk you through very quickly the idea that we had never done this before as a city. We hadn't, certainly not since 1918, and none of us were around to remind ourselves what that was like. And so we realized there were probably about 120 different things we could do. What was most important? We met as a team. One of the last times we met together as a team, city manager, key decision makers, we went through all the different things we could think of that could be a priority, and we debated them, we assigned prioritization to them, and we worked together to create the roadmap that gave us a sense of what delivers the most value to you as community members, what is most important for us to focus on. And we ended up with this roadmap, which has surprisingly held together for about the last 10 months. Top 4 priorities. Number 1, compliance with the public health orders, because if people comply, they're going to be safe. 2, our main role in compliance with public health orders is continuity of essential services. If you're going to stay at home, you need your garbage picked up, you need police and fire response, you need the water coming in, you need the sewage going out.
I have a quick question. I do have one quick question, because we're talking about quarantining people. And you have been in Africa, and Africa has a very low number of cases. What accounts for that? Yeah,
it's a good question. You know, I'm curious about
deaths too. I mean, New Guinea 76, Guinea 76, Nambia 151, Angola 350, Mozambique 132, Senegal 333. Madagascar 251, very low numbers compared to Europe or the United States. What accounts for that in Africa?
Yeah, there's a couple of things that I don't know. One of them things, unfortunately, that is contributing to that is the fact that the health surveillance systems in those countries are typically very poor. So they're not capturing the full extent of the deaths. And there were some key health monitoring systems that were funded by the US government that were defunded a couple of years ago. So our ability to get good health data from those countries is low. So I suspect that those deaths are severely underreported in the African context. There is some indication that there may be something else that's going on there, and I haven't actually done enough research on what's happening in Africa to understand that, but it is an interesting point.
Thank you.
So continuity of essential services. Next one was supporting our at-risk communities. So seniors, our folks who have to be our what we now understand as our essential workers, grocery store workers, people with what we refer to as access and functional needs, who might have either disabilities related to hearing or mobility, different language groups who might not speak English primarily, and those with pre-existing conditions, making sure that people can get through it. We don't provide all of the safety net social services in the city. The county provides a lot of those, but one of the ones that we surged into, and I'll talk a little bit more about this, was food. Because really, if you look at what you need a place to live, you need something to eat, right? And those are huge. And so we've played a huge role in both sheltering of people, especially without homes or who are at risk of homelessness, and also providing food across the bay. Across the county. And then our fourth priority is a focus on our own staff, because we realized early on that this was not a sprint, it was a marathon, and that we needed to make sure all of our employees could do what they were doing safely, because it doesn't help if they go out, get infected, and then they can't provide that service. So we have a big focus on what we call powered by people, and making sure our own staff are safe. And then supporting functions from communications to making sure we're getting as much cost recovery so we don't have to lean on local tax dollars, to future planning, because this is changing. The number of unknowns in this are just absolutely incredible. And that's what makes it much more complicated than a number of other disasters. So very quickly, things like communication, we started out communicating mainly in English. We quickly added Spanish and then Vietnamese, and then simplified Chinese and traditional Chinese. And we now communicate regularly in those 5 languages. We use social media. We use broadcast media. We now are using in-place media, bus shelters, physical advertising, pamphlets left at food distribution sites. We use influencers speaking in the languages that people speak. We've had, I think, almost 40 different influencers in almost as many different languages getting the message out. For those of you who are, the gentleman with the great tiger stripe hair is a member of Los Tigres del Norte, which is, if you are in that community, the equivalent of the Rolling Stones. They're actually here in San Jose and have great music and are extremely influential. So he was kind enough to do an influencer video for us. So we've been getting out flash reports. I think we're at about 139 that we've put out to date, and messaging, reinforcing the county's message and creating our own that we've tested with various language and cultural groups. We've also been looking at data on compliance. This is data that is provided through people's cell phones voluntarily. It's anonymized, so we don't know who you are or what's going on, but it helped us understand if people were sheltering in place, where they weren't, and where we needed to change our messaging and encourage those behaviors. We believe that the best way to get compliance is education, and help people understand how to keep others safe. But we need to keep an eye on, especially in the early days when we didn't know how effective this was going to be. And again, as I mentioned, all of those different services that we need to keep moving. One of the things that I'm most proud of is the fact that we haven't missed a beat on most of the basic city services. The garbage pickup, there were some cities that stopped doing garbage collection, for example. We didn't miss a single route that I know of, other than the normal hiccups of the occasional tossed over can, but no better or no worse than we do in normal months. Same thing with the water pollution control plant and the fire and police services. Meals and food are an interesting one. The city of San Jose, prior to COVID, served about 850 meals per day in several of our senior sites. When the county realized what was happening and they knew that they were going to have to be the lead on both the public health and the health aspects, they said, City of San Jose, can you help us out? Can you take lead on food citywide, countywide? We said yes. Honestly, we didn't fully understand what we were getting into. But there are over 300 nonprofit partners in that space already, led by folks like Second Harvest, who are phenomenal. We worked with them, and we rapidly scaled both our capacity and their capacity. And 5 weeks in, we were responsible, along with those partners, for delivering 325,000 meals a day. So if you can see here, we had 3 principles: feed our most vulnerable, maximize our existing food networks, and scale for a widespread food crisis. At the time, we weren't sure if the supply chains would work. We weren't sure how big the crisis would be and how big demand would be. So we had to really build in capacity for a huge amount of food and some very creative ways to bring that to people. Again, this is the team that I mentioned. We put together some of our premier folks from our Parks and Rec team who know the community deeply and have big hearts, and some of the folks from our innovation team who are stone cold good business people, and paired them up together so that you have the ability to scale this. And as a result, within about 5 weeks' time, we scaled a new business, adding about 1.5 million additional meals a week capacity to the existing system, and making sure that those meals were getting to who they needed. We developed a data backbone and dashboard that helped connect demand and supply and coordinate that in a way that assured that we had no significant food gaps. So there were periodically ones that emerged here or there that we were then able to plug. Here are just some examples of the many food sites that we were able to open up in partnership with our nonprofit allies and fund over the last almost year now. I mentioned briefly access and functional needs. I think I saw Molly McLeod on earlier. I'm going to have to give a shout out to Molly, talking about fierce and relentless advocates. One of the things that Molly has been a persistent and articulate advocate on when she was in the city and now that she's retired is the question of access and functional needs. It's also, I'll be honest, one of the areas that we need to continue to improve. It is one of the groups that is extremely vulnerable, as always, but particularly in this time where the public transportation has been cut, their stay at home, many of the services that they provide depend on are no longer available. They're in greater social isolation, and they may also be facing pre-existing income issues and others that are exacerbated by the economic crisis. So during this, we've been working to increase our language capacity, really improve a lot of our functioning across all of our units and how that we engage with the access and functional needs approach. And we are doing a more extensive survey with partners and bringing in some more training to our Emergency Operations Center. But as I said, this is a learning experience, and this, I'll be honest, is one where we need to continue to learn and grow. I briefly mentioned powered by people, the notion that at the center we need to have a safe workforce. We had to switch to digital in the course of a week. We weren't necessarily a work remote culture at all, and we had to move all of our functionings remote. Fortunately, we'd spent about 4 years preparing in terms of upgrading our technology, switching from desktops to laptops, building up our technology staff that allowed us to go, not without a hiccup, but relatively seamlessly in the course of about 7 days to an almost fully digital platform. And so there's a whole set of wraparound things that we need to do that are frankly pretty boring, and I won't go through them all, but allow us as a workforce to continue to function with a relatively high level of productivity, even in the middle of this pandemic. And as I kind of wind down here, I'd mentioned the 3 challenges of now, and really any one of those would have been the most complicated thing that we had done as a city, or certainly I had done as a senior leader in the city. All 3 of them together were overwhelmingly complicated, but apparently 3 wasn't enough. So we all then came across in the wake of George Floyd's killing and the protest, really having to address and look at issues of systemic racism and equity, and deal with that in the midst of the pandemic and the issues that had been exacerbated by this pandemic. Then if 4 challenges weren't enough, we had to respond to wildfires and power shutoffs. We came within a hair's breadth of having to evacuate a significant portion of one of our council districts. And all of us had to endure Martian skies, poor smoke quality, and all of that while we were figuring out how does the mask work for smoke and how does it work for COVID, and while I'm trying to get people out responding. So all 5 of those challenges are ones that we've had to face together all at once. So where do we go from here? Well, just like we went up the ladder, we're going to go down the ladder to eventually something resembling normalcy. Unfortunately, like a game of chutes and ladders, there's some backwards as well as forwards on this one. We had gotten as far as stage 8, progressing toward the eventually hoped for stage 10. We've been pulled back into stage 6 or tier 1, which is a more restrictive set of openings. But the hope is that once we get this under control, we will progress forward towards stage 10 and back to something resembling normal life.
Kip, we have about 15 more minutes, and I wanted to get into some questions. So
I'll wrap it up in 1
Okay.
minute. How about that?
Great.
So the vaccine will be critical for that. The good news is we have a number of great vaccine candidates. The bad news is it's not as simple as you might think. There's complex cold chains that are required. Most of the vaccines are 2-shot vaccines, and there still is a number of steps of approvals and scaling that have to be done. Good news is our county will be in the lead on that. They have a lot of deep expertise. And routinely do vaccination campaigns on things like the flu. And so I have a high level of confidence that by the summer, we'll be getting back to a position where we can resemble normal. The first waves will hit our healthcare providers, our emergency responders, and those who are at high risk, especially our elderly and those with what are called comorbidities, which is pre-existing health conditions which put them at higher risk. And then it will go on to other categories of essential workers, people who might be frequently exposed, and so on until the entire population has the vaccine available. At this point, there will be no mandatory vaccinations, but there will be hopefully widespread and freely available vaccinations to everyone. And so with that, I'm going to wrap it with just a, if you want to volunteer, there are some opportunities to volunteer, though they're more limited than they used to be. And if you want to do some training for yourself, there is the opportunity at ready.gov. And I will conclude there with a little bit of art and turn it back to you, Councilmember.
Great, thank you. That was really informational. I really appreciate that. I have a couple questions though for you regarding notifications and of evacuations and that sort of thing. We have a lot of seniors, particularly senior mobile home parks that may not have access to technology in the way that we have been communicating with folks. So what is the plan for notifications of evacuations? And I know that early on when I was a council member, I received notification that we were talking about evacuating for flooding, flash flooding, actually along the Ross Creek, which surprised me that we could have flash flooding in District 9, but I remember the phone calls that we had. So at that time, do you want to talk about how we notify folks when we are in an evacuation situation and what might trigger an evacuation?
Very good question. We have about 12 different approaches to notifying, and essentially we use all of them because what we know is it is not a one-size-fits all. So we do have a number of electronic means of notification, and if you do have a smartphone and you haven't opted out, stuff will automatically pop up on your smartphone is one of them. There's also an Alert SCC that you can subscribe to, Alert SCC, which will give you more tailored notifications. And then we'll of course be using media, social media, Nextdoor, all of those things. But to your point, what if I don't have a smartphone? What if I'm not on my phone? What if I have my device off? We realize that nothing beats high touch, and that we will be doing a number of things. We have what's called a long range acoustical device, which is the loudest speaker you have ever heard, which we can hook up to a truck and we can tow around neighborhoods and we can blast out in multiple languages evacuation orders. We also have teams ready to go to do door-to-door knock and talk evacuation. We would prepare materials and have that available. Typically, the things that would require an evacuation would be something like a flood, if you're in an area that's prone to flood. If there were a catastrophic accident like a plane coming down in a neighborhood, we would evacuate out an area. For earthquakes, you generally shelter in place. We would obviously identify buildings that had had catastrophic failure, and we would evacuate from those buildings or those areas. But for earthquakes, generally the rule of thumb is shelter in place if you can do so safely. So we've realized that we need to do about 12 different ways of noticing people, and we cannot rely entirely on or exclusively on electronic media.
How do we, in the time of an earthquake, and I remember 1989, I actually lost my house in 1989 and had to get on the road and get to a place that wasn't my destroyed home, and traffic was a mess. So how do we coordinate traffic patterns to get people off the road so that emergency vehicles can get through?
Yeah, it's a good question. Part of what we'll do is identify key corridors, and we'll clear out some corridors that we will either reserve certain lanes for or make sure that we have priority access, because we're going to need to move emergency response vehicles through. Part of what we'll be doing in the early hours is we'll be rapidly assessing building damages. The biggest concern we'll have in an earthquake are some of our apartment buildings, which may be more vulnerable to collapse, and rapidly assessing if those folks need assistance. One of the weird things that will happen in an earthquake is you may have what would normally be a 911 emergency, and you may see an emergency vehicle drive right by you, right? Because they're going to have to prioritize and triage. And one of the things they need to do in order to do that well is understand the totality of what's going on. If they stop at the first person with a broken ankle, then they may not get to the apartment building that's collapsed with 150 people who are at risk of dying. So one of the key things you can do is, as much as possible, be prepared to take care of yourself and take care of your neighbors if you can. Because what we'll be doing very rapidly is trying to understand where we need to go to the worst, clearing safe routes for both assessment and evacuation of medical personnel and any of the injured or victims.
Great. I have one more question, and then we're going to take some questions from a couple of folks in the audience. Can you talk a little bit about the district emergency centers that will be set up in case of an evacuation, and how they will be handled at our community centers, but particularly since we have Camden Community Center, focus on Camden Community Center, if you could.
Yeah, so part of what we're likely to have in the event of an earthquake is we'll want to have places where people can gather. We'll want to have places where you as the council member can stay in communication with both us as the city and with your constituents. So we have the ability to set up these district disaster offices, not calling your district a disaster. These district disaster offices which are essentially a mini communications post for you. And I and others in the EOC will have direct communications with you, and you'll be right there at a place like Camden, which is an ideal location. It's a very well-constructed building. We're doing some improvements actually to these things over time to actually make them even better suited toward these functions. But we'll have them probably as something that we call a local assistance center, where you can come in and you can register, and if you need food assistance or you need other types of assistance, that we would actually ideally have a lot of that available there. Or if sheltering needs, we will identify whether it's Camden or other areas where we would be providing emergency sheltering. One of our options in an earthquake is actually to rapidly build emergency sheltering, what are called strong back tents, and put those up in an open field or an open area. What you find also is that psychologically, a lot of people don't like to go back inside after an earthquake for very obvious and actually logical reasons. So a lot of people will want to be shelter outside, even if they have a home. And so we would accommodate ideally anybody and everybody who needed shelter temporarily, and make sure that they had a safe place to be, and also begin the feeding, medical triage, the mental health support, language support, and anything else that might be there. And you as the council member would be right in the middle of that, quite literally, and in communication with us to help us understand where we might be missing, what we might need to change, so that we could reallocate resources, or in the cases we couldn't, help you understand what the other priorities were that were competing, so that you could help explain why certain things were or weren't happening.
I also remember back in the earthquake how helpful the Red Cross was, and FEMA, and how we were able to go to a school site and get access to Red Cross assistance and FEMA assistance immediately. So I would assume they would be a part of our strategy as well.
Absolutely. They will be in our emergency operations center. We'll have liaisons with Red Cross and other, we have a whole, literally a cadre, that's their name, of nonprofit organizations like Red Cross and others that are prepared to respond to an emergency. We would formally activate them, and we would have them as a part of our command and control structure, working with us hand in glove in the emergency operations center. Red Cross is fantastic, and they would be right there. So many people volunteer with them. They're a wonderful organization.
Great, thank you. Michael, who has their hand raised?
Yeah, so we have Martha and we have Molly, and then we have a question on Facebook from...
Here's how you know the ruling class does not believe this virus warrants
Let,
the lockdowns that they are ordering.
You.
Thank
Sorry
you.
about that, guys.
That wasn't me.
Go ahead.
I didn't do it.
Bounce it up.
Okay. I asked about evacuations and had a very small part in getting you here, Kip. So my question is, I live in a senior mobile home park. Lots of folks do not have cars. Lots of people are night blind. Lots of people live alone and are fragile. What do we do? And I've signed up for the notifications. I get a phone call. What am I supposed to do?
Yeah.
I'm night blind. I live alone. What is the city going to do to not just tell us you're supposed to leave your home, but help us know where we go? What do we do?
I'll say two things. One is the incomplete, that there's more that we need to do, but the immediate, let's say it happened today, right? One of the things that you can do as a leader is to help us understand that situation, because we may not understand block by block what's going on the way that you do. But if you help us understand, okay, I've got a facility with a bunch of seniors. You know what? Nighttime is not an easy way for us to navigate, and we don't have cars, and you don't want us driving if we did, right? Well, what we would do is we'd set up a transportation point. We'd send people out to you, and would be identified in vests and with badges, so you know who they are. We would liaise with you, connect with you, and then we would help do an assessment of who was there. We would work with Valley Transportation Authority probably to get buses brought out, so that we would actually transport you safely to the areas that you need to be. If there's medical attention, we rely on our fire department primarily for that. They have ambulance services, they have medical personnel. So it'd probably be we'd set up a post there with folks who we would work with who could evacuate you safely in our own vehicles, which we would provide.
Okay,
So
great. I won't take up more time. I just want to know that's wonderful, but that message needs to go out to people like me. And Pam has my email. So send me the information where I'm supposed to get these folks or this facility registered, and I'll do that.
Thank you very much. It's a really good question. I appreciate you bringing it up, and also the challenge to us.
Martha, you've added to my to-do list again, but that's it's a great follow-up for us. Thank you. Molly, you're next.
Hi, I'm Molly. Thank you so much for this opportunity, and thank you, Kip. And I didn't know that your home had been destroyed, Councilmember, and that really gives that personal understanding of the tragedy. So I appreciate your willingness to share that. I also wanted to thank you, your staff person, Cameron. Today, on extremely short notice, I had found about a resource at 4 o'clock today, 15 minutes ahead of time. I let her know it was about Tech Accelerates Disability Resources and Disasters. My understanding was she was going to attend that event. It had lots of wonderful resources, including from the World Institute on Disability and a new organization, Global Alliance for Disaster Resource Acceleration, which focuses on a lot of tech companies. So it was interesting to have, for example, the San Francisco Office of Disability, they have an actual office on disability, was there. And then talking about tech companies that talked about the heart of Silicon Valley, but no Silicon Valley jurisdictions represented here, except for listening. And when I think of San Jose, I think about innovation and smart cities and all that we can do. And so there are opportunities that we could be taking, connecting up with, including Zoom, which is a San Jose company, has plans to, but has not yet put out, and it won't be whether it'll be a for pay option or not, the automated captions. So the webinar that Cameron attended today had the best practices of an ASL interpreter, the CART, which is real-time captioning, as well as introducing yourself with your name each time you speak, so that on a transcript, that type of thing goes. And thanks to your willingness to take up my challenge, one new skill, access skill a week, which I greatly appreciate. Kip, I want to extend that to you as well. And I know you're a history buff, so I'm glad to report that the film Invalid Corpse is coming up for free, and I'll send you a link. But it basically, in the times of the American Revolution, the invalids, those who were sick and injured from war, were the ones who stood between the invading armies coming to Washington, D.C. So it's not only thinking about the vulnerabilities, but also the insider knowledge that Martha Crawford just shared, that I share, that many people can bring, that, as you said, is not yet being tapped. I do think that the open, candid, direct is extremely important, and so I was a bit concerned on the San Jose white paper on serving vulnerable populations. The first draft was very rah, and not, this is real, let's get real, let's identify the next things to do. So I'm hopeful that with the information that you've shared in the process, that they'll really see that commitment to people with disabilities, who are always the first, middle, and last to die in disasters. And there's some cool resources. So I mentioned the San Francisco Office on Disability. I also want to give a shout out to Georgia, which actually uses a deaf interpreter for the COVID-related updates. And I'm saying that correctly. It's actually a person who's deaf who is the interpreter. And they either get the information from the written transcript or from a hearing interpreter to add the extra context and value and ability to communicate. And then the other one being Boston. It's really important to keep the livelihoods with the businesses. They provide ramps to outdoor dining. In contrast, City of San Jose is approving al fresco, and from the department that I used to work at, and it blocks access. So thank you so much for the opportunity to share the concerns as well as the kudos.
Hey, thank you, Molly. I really appreciate it. And that's a good way for us to wrap up. You challenged us a couple of weeks ago, and we're trying to make our Zoom meetings. Oh, I love the heart. That's great. I love to make our Zoom meetings accessible for all. We haven't reached it yet. Zoom doesn't have the technology. In fact, we talked about it today at our office, at our staff meeting with Cameron. So it's at the forefront of our minds. Seniors and accessibility are at the forefront of our minds, and I will continue to advocate and bring those up next time we have a COVID update at City Council, which I think is Tuesday. So if you're interested in hearing more about what the city is doing real time, you can Zoom in for that meeting, for the City Council meeting on Tuesday, where there will be an update. With that, I want to conclude, because I really value your time. We've had an hour of really good discussion. Kip, this was really helpful. I appreciate the information, and I hope that our residents found it as useful as I did. If you have any other additional questions that we weren't able to answer, please email to us, and we will email the responses back to you. Kip, thank you for joining us. Thank you for all that you're doing. I know that you've had a lot of sleepless nights with all the commitment and time and energy you're spending with the EOC and the pandemic. And so I hope you get some time to sleep and relax and enjoy your family. But I will see you Tuesday at the meeting. And thank you so much for joining us. And thank you to the residents for being here and attending and listening. Thank you so much.
Thank you, everybody. Very good to hear from you. Bye-bye.
Bye.
Thank you, Kip.